Good day, everyone. I'm pharmacist Mustapha, a clinical pharmacist in West African Teaching Hospital, and it is World Pharmacist Day again. Every 25th September of the year is set aside to celebrate pharmacists. So the theme of this year, 2023, is Pharmacists Strengthening Health System. We do that in so many ways, but I'll talk about strength through optimization of medication use. Let me give you background details of medication use. One of the major areas of intervention in the treatment and prevention of disease is the use of medications. However, the unintended consequence from the use of medication regimen that are not optimized for the patient has been estimated to cost the United States about 528 billion US dollars. That's based on 2018 data, and it has resulted in more than 275,000 deaths annually. The values incorporated the downstream cost of hospitalization, emergency department visits, additional clinician visits, and additional prescription medication due to treatment failure, and a new medication problem, or both may even arise when medication regimens are not optimized. Let me refresh our knowledge on the drug therapy problem that translates into therapeutic failure. They are categorized into 7 groups. 1, needs additional drug therapy. 2, unnecessary drug therapy. 3, wrong drug. 4, dosage too low. 5, dosage too high. 6, adverse drug reaction. And 7, inappropriate adherence. So let's get down to today's business. What is medication optimization? It simply means crafting a pharmaceutical regimen which yields the chance of successfully managing disease that factors in characteristics of individual, including their social determinants such as the demographic and financial status. The consideration of patients' financial status has highlighted importance as medications has grown much more expensive. And who is better at doing this than those who are trained in pharmacoeconomics? Of course, with the pharmacist. The impact of pharmacists in optimization of medication use cannot be overemphasized, and I have some evidences to buttress my claim. Firstly, a meta-analysis in the Journal of American Heart Association of 39 clinical trials and 14,224 patients found that care that involved pharmacists led to improved reduction in diastolic and systolic blood pressure than normal care without pharmacists. Parts of the direct intervention made by pharmacists include drug monitoring and adjustment of medication, review of patients' home blood pressure log, guidance on appropriate medication consumption and adherence, development of patient-centered medication action plan, and development of medication reminder system. The second evidence was in 2016 analysis of nationally representative United States data that examined 26 classes of medication from 2010 to 2012, and it found a potential saving of 73 billion US dollar overall and 25 billion US dollar for patients if less expensive therapeutically equivalent medications are selected. This shows that there is a strong need for improved collaboration between the physician and the pharmacist to improve evidence-based cost-effective medication use. Now, in summary, we can boldly say that optimization medication usage helps to realize the potential of medication to improve patient-centered care as well as cost-effective care. I would also like to chip it in that the first widely adopted efforts to promote medication optimization was the MTM, which is the medication therapy treatment, but it has its own limitation, like being mainly medication focused and also lack of access to necessary resources such as the electronic health record and real-time updates in patients' profile. So this led to expansion of MTM steps into a more holistic and advanced medication optimization strategy, which is designed as a patient-centered approach, and that design is known as CMC, Comprehensive Medication Management. Optimize, of course, there are several ways pharmacists can optimize medication use. It can be done through medication review and reconciliation, pharmacotherapy management, patient education and counseling, medication safety and monitoring, and the last one, collaborative interprofessional practice. On this note, I would like to say to my dear colleagues across the globe, happy World Pharmacist Day. We rock.